But I'm heartened that we appreciate that they are essential to save lives and livelihoods, and I thank all of you for your continuing cooperation. As of Wednesday, 6th May, a total of 135,902 tests had been conducted, with our country's total number of confirmed cases standing at the time at 3,091, with 303 recoveries and, sadly, 18 deaths. On Thursday, 7th May, 14,046 more tests were conducted, and this included the clearing of the last set of backlogs. Our total confirmed cases then rose to 4,012 positives, i.e. 921 new cases. Our recoveries stood at 323, 8 persons were critically ill, and deaths still at 18. It is important to stress that 533 out of the 921 new cases recorded between last Wednesday and Thursday are factory workers from a fish processing factory located in Tema. All 533 persons were infected by one person. Again, let me reiterate that these new 921 cases were from backlogs dating as far back as 26th April and not necessarily over a 24-hour window. The coming on stream of 7 more testing facilities across the country to complement the efforts of the Noguchi Research Institute, the Kumasi Center for Collaborative Research, and the National Public Health Reference Laboratory at the Kolebu Teaching Hospital have meant that we have been able to clear all the backlog of tests, and the reporting on the cases of infections since Friday, 8th May, is now current. On Friday, a total of 5,253 tests were conducted, with 251 positives. On Saturday, 2,255 tests were conducted, with 266 found to be positive. For today, Sunday, a total of 3,045 tests have been done, with 160 testing positive. These relatively lower daily numbers of infections are welcome and reinforces the fact that the measures instituted to help reduce person-to-person contact and help defeat the pandemic are working. So, as of today, Sunday, 10th May, the country has conducted a total of 160,501 tests, with our total number of infections standing at 4,700, with 494 recoveries, 5 persons being critically ill, and 4,179 persons responding to treatment. 22 persons, virtually all of them with underlying illnesses such as hypertension, diabetes, and chronic liver disease, have unhappily died. We must understand that the more people we test for the virus, the more persons we will discover as positive, and thus have the opportunity to isolate and treat them. If you do not test people for the virus, you will not find the persons who are positive, let alone isolate them from the population and treat them and prevent them from spreading the virus. Indeed, had we not been proactive in undertaking enhanced contact tracing of infected persons and had relied solely on testing persons who reported to hospital, which is the practice followed by some other countries, i.e. routine testing, our total case count would have stood at 1,413. The other 3,232, i.e. 2/3 of the population of positives, would have been undetected, and still be within the population, unknowingly infecting others. I know some political actors will want you to believe that our current numbers represent a failure on the part of government. Do not begrudge them. They need to make such comments for their political survival. On the contrary, we must be emboldened in the knowledge that the 4,700 persons infected so far with the virus have been identified, taken out of the population, isolated, and are being treated. The implementation of our strategy of aggressively tracing, testing, and treating is our surest way of rooting out the virus. This early identification of persons with the virus ensures that they do not spread the virus to others. We are provided with the opportunity to treat them, and it helps us to understand better the dynamics of the virus. The rapid implementation of all of our policies has resulted in our low infection, hospitalization, and death rates, some of the lowest in Africa and indeed the world. We certainly must be doing something right in Ghana. Our country has administered more tests per million people than any other country in Africa. And in fact, the World Health Organization, WHO, has reached out to us to share our sample pooling experience with other African countries so they can adopt this strategy and also ramp up their testing capabilities. It is thus vital that we continue to maintain the measures of enhanced hygiene and social distancing protocols to contain the spread of the virus, as they are the surest way to a quick return to a life of normalcy. All stakeholder bodies I have interacted with over the last 3 weeks in the health, labor, religious, chieftaincy, educational, hospitality, tourism, and creative arts sectors share in this opinion because collectively we believe they are essential for our very survival. These groups are also being engaged on the way forward towards the easing of these restrictions so that our social and economic lives can go back to normal whilst protecting lives at the same time. Soon those engagements will enable us to design a clear roadmap for the easing of restrictions. In my address to workers and the nation on May Day, I announced the extension of the closure of our borders for 1 more month as the means to continue halting the importation of the virus into our country. Tonight, I've come into your homes to announce that the ban on public gatherings, as set out in executive, undertake the important work it is already doing. Let me once again thank the healthcare workers, including all those responsible for the tracing, testing, and treating, for their heroic contribution to the fight against the pandemic. They will be long remembered in our history. In advance, I say a hearty aiko to the Ghana Registered Nurses and Midwives Association, which celebrates its 60th anniversary on Tuesday. This weekend, I chaired a 3-day cabinet retreat at Peduase Lodge to examine in detail measures aimed at reviving and strengthening our economy. I'm happy to reiterate that government is putting in place a resilience and recovery plan with the overarching aim of finding more resources